Hi there, my name is Sandy Kopp, and I'm here to interview Dr. Brendan Finucane, who served as the ASRA president from the year 1998 to 1999. He also received the Gaston Labat Award in 2003. This interview is part of the activities surrounding the 100th anniversary of the founding of the first American Society of Regional Anesthesia in 1923 by Dr. Gaston Labat and colleagues. Although this organization is not related to the current day ASRA Pain Medicine, which was founded in 1975, it has been said that the current society would not have existed quite like it does today without the work of Dr. Labat and the original ASRA. So it's my absolute pleasure to welcome you, Dr. Finucane, as again, the past president from 1998 to 1999 and a previous Labat Award winner in the year 2003.
Thank you very much, Sandra. Good to talk to you again.
Yes, I actually had the pleasure of interviewing you in 2015 as part of the 40th anniversary of ASRA.
That's right. I remember that. I remember well.
Yeah. So I want to talk a little bit about both your presidency as well as your Labat Award. We'll start with the presidency. What at the time, what were the predominant issues that ASRA was dealing with during your presidency, 1998 to 1999?
There were many. I guess the organization was a bit challenged in terms of the management of the organization, and so we had to really work through that, and actually it was a very long process, but it worked out in the end to be very, very successful. And I think that was a major challenge. We weren't sure totally who we were as an organization, but we knew where we wanted to go. And so one of the other elements as well was that we needed to bring more young people into the organization and to have a turnover on a very, very regular basis. Whereas before, the organization had become a bit static. And I remember it was people like Ben Cavino who said, look, we need to attract more of the younger set into this. And actually that did occur and actually was very successful and continues to be. And today I look at the organization and it's really thriving, actually, compared even to the time that I was involved in it. And I never imagined actually it would be this successful at that time. And so I'm very pleased to see what really did transpire.
Well, I feel like I was personally a beneficiary of your push to get younger people involved in ASRA, because at the time, right about that time, so I started my residency in 1999. I got involved in ASRA very early as an early CA2 resident, and became the resident section chairperson. But at that time, the resident section was like 5 of us, sitting in a meeting or sitting in a little room. But that's, I mean, as you know, the ASRA resident section, which you probably helped found, by making a place for young members, has really been an example for many other subspecialty societies since then. So I commend you for your work in that.
And it was a little different too, because, well, actually, I wasn't in Canada at the time, but I subsequently did go to Canada. But Canadians were a big part of ASRA. In fact, I think they were the largest section of that, largest number of non-American, I would say, members. And it only makes sense where our two countries are together in many ways. So that was another element subsequently for me, was the, representing Canada and encouraging Canadians to become involved, and they did, and I'm very pleased that they did and continue to.
Correct. Yeah, excellent. So who did you find to be most helpful as a mentor or as an ally during your time as president? Were there particular people that you surrounded yourself with that you thought were the most helpful to you?
It actually was the people who maybe went before that were very encouraging, and the people I remember very well were Ben Cavino. He was a fantastic mentor, and he was one of the great leaders of saying, "Let's move on. Let's make this a thriving society with young people as well." And the other person who strongly encouraged me was Prithvi Raj. He was always very encouraging, and before I even came on the board, he says, "You're going to be on the board, and I'm going to make sure." And it happened. In fact, I had left America by then, and so it was. I never dreamed it would happen. I said, "Well, I'm gone now." So, but he said, "No, we're going to get you in here," and he did. And the people actually at the time were Richard Rosenquist was tremendously helpful, and of course all the founding fathers, they were very, very, very supportive, like Alan Winnie. But I specifically say Prithvi Raj and Ben Cavino. He was phenomenal, and of course it was a great loss when he passed.
Mhm. I know from our previous interview, you had mentioned that it was Dr. Winnie that probably helped pull you from SOAP over to ASRA, that he was instrumental in that because he was so excited about regional that he got everybody really excited about it.
Yes, he was, because he was such a just a powerful lecturer, and just go listen to him and he would just draw you in. And like I said, I spent quite a bit of time doing obstetric anesthesia, but I wasn't doing obstetric anesthesia eventually, and so the jump from SOAP to ASRA was not that difficult. But with people like Alan Winnie, Prithvi Raj, Covino, they drew a huge number of people in, and I'm not sure what the numbers were in I think I joined in maybe 1976 or 7. I'm not sure. You probably have that information, but and I'm not sure what the numbers were then, but I know now it's one of the biggest subspecialty societies in all of anesthesia, if not the biggest.
Yeah, I don't know either, but I definitely know it's quite large, and I know that a lot of the things that ASRA has done are viewed by other societies as a model. Our special interest groups. I frequently get asked from people in other societies, how we've done that. Like I said, the resident section has always been a model for people. So I mean, I think ASRA just has a lot to be proud of, and it's largely because of people like you who came before and really helped create this organization, and that keeps people coming back.
Right. Let's see. I'm trying to think of other people. And again, as you get older, your memory is not as sharp. But they're a tremendous group, because there was like a family, really. There was a lot of fun and laughter and great humor, and they were a great group and continue to be a great group, and I would call them a family for sure.
I was trying to find the picture. I don't know if you remember this, but one of my very first ASRA meetings, we were all up. It was Terry Horlacher had those temporary tattoos, and we were all up in somebody's suite, and we were all like making a muscle with our temporary tattoo. And I was so new. I might have even still been a resident at the time. And I just remember thinking how welcoming ASRA was, and what a special organization this was. And I haven't missed a meeting since. It's been now 22, 23 years. So I know what you mean about it really feeling like a family. But I remember that picture. I was trying to find it so that I could show you during this interview, but I couldn't find it.
Yeah, I do remember the event though, and Terry had tremendous imagination. It was a lot of fun, for sure.
She still does. Yeah. So thinking back, what changes do you think in thinking or practice did you help foster? I know you talked about the younger people. Are there other things?
Well, I think to do regional anesthesia and to continue to do it when we started out was a great challenge because, you know, we were always being teased by our surgical colleagues, and you know, that, well, you know, you're only successful 75 or 8% of the time, and so that was a hard battle to fight. But those of us who are really enthusiasts about regional, you know, we were able to take that teasing that continued, and of course surgeons didn't like it particularly because it was a little slower. But the big issue that we were trying to foster or to put forward is, look, you know, pain is a real thing, and local anesthetics really do help. And using opioids to treat severe pain or acute pain, you know, it's not the best approach. And in fact, the more local anesthetic agent you use, the less and less opioids you will need to use. And if you look at what's happened in the last 25, 30 years in both our countries, it's just absolutely shocking to know and to see how many people have become addicted to opioids. And you know, our idea was that, you know, local anesthetics don't do that, and the more local anesthetics you do, the less opioids you have to use. And that was a very huge principle that those of us in regional anesthesia, we all believed that. It wasn't totally, you know, it wasn't perfect, and we didn't hit the right spot all the time, but if you didn't get the block to work for surgery, it did contribute a huge part to the post-operative care of the patient. And that was a principle that lives through to this very day, of course. And we've seen the tragedy of what opioids do.
Right. Yeah, no, I completely agree. So now moving on to 2003, they call you, or I don't know, maybe who let you know that you had won the Labat Award, and when they called you, what did that mean to you? What thoughts went through your head?
Well, I can't even remember who called. I thought it was maybe just an email, but it might have been a call. Well, I know, like I mentioned already, Sandy, I was already tucked away in you know, way up in the northern hemisphere in very, very cold climate. And when I got the news, I was totally shocked. I had never ever entered my head that I would be given this award.
Huh.
And I remember I was quite sick at the time. I was on chemotherapy, and I was saying to myself, man, this is, you know, I'm not sure if I'm going to be able to give this lecture. You know, that was the first thing. But fortunately, I was, and fortunately, my illness, you know, was successfully treated. So, but I wasn't well at all. So it was an enormous shock to me.
Oh, well, it
Yeah.
was definitely well deserved, that's for sure.
Thank you very much.
Now you mentioned back in 2015 when we talked that that you were happy to see ultrasound, and you thought at the time that we had all the tools that we needed. You actually said in our interview, how could things possibly get better? Do you think they've gotten better since 2015? And what do you see for the future of regional anesthesia?
Yeah, it's very hard to predict what's happening, but I mean, we never would have thought that when we started, you know, all we had was a bottle of local anesthetic, we had a needle, and you know, we had faith and prayer and some knowledge of anatomy, and that's all we had. And you know, the next major step forward, and I give Raj that credit, was the nerve stimulation. Although he didn't invent nerve stimulation, but he was the one that promoted, let's use nerve stimulation. It's at least, it gives you some idea that you're close to a nerve, whereas before we didn't have anything. And then when the ultrasound came along, it was even better again because you could see the nerve. But also Prithvi Raj's idea of the nerve stimulation, when you combine the two, of nerve stimulation and ultrasound, you'll get an even better result. And I think Ban Sui promoted that concept extremely well in his textbook. on ultrasound in regional and nerve stimulation, which is, I think, one of the most popular books in regional anesthesia for sure worldwide. So the two, combining those two things together, I think was probably the next step after ultrasound by itself.
Sure.
So I think again, I'm not in the clinical arena anymore, so I don't get you know I don't see exactly what's going on, but I know that it essentially all those anesthesiologists who just weren't interested in regional anesthesia because it only worked 70 or 80 or 90% of the time. They were all bought in by this, and they had to learn how to do it, and it's now part of regular practice. And if you don't do it, you're going to be missing out quite a lot. So in training, yes, it's there's a lot more interest in regional anesthesia now than there ever was before.
Yeah, I agree. Yeah, it's quite popular. I mean, just looking at the number of fellowships and, the fellowship now being ACGME accredited, it's really great.
Yes, absolutely. So I'm glad to see that it continues to thrive. And I don't know what the next magic bullet is, but we're very, very close now.
I know we've got to be, don't we? It's about time that something new comes up. But yeah, I agree with you. When ultrasound came up, it's like, well, how could there possibly be anything better than this? But again, people said that about nerve stimulator, right? So
yeah, exactly. Well, now the combination of the two together, and not everybody does that, but that, like I said, is what Ban Sui, really promoted, and he makes it work very well. And
yeah, I agree. So back when I interviewed you in 2015, I asked you at the time what 3 words were to describe ASRA. So I'm not going to tell you what you told me at the time, but so I'm asking you now again, what 3 words you would use to describe ASRA and why?
Yeah, I don't remember exactly what I said, but the interview's out there somewhere. So, but I haven't really changed that much. And maybe I've added a few more words. And I think the word I used initially was education. That's what ASRA was all about. That's why I came to ASRA. I told you my story. I basically was trained in Liverpool and in one of probably the best training programs in Europe at the time. But nobody did regional anesthesia. We did do epidurals for obstetrics, but to actually, I never saw anybody do a spinal anesthetic in 4 years of training in Liverpool. And so, I felt like I missed out on that. And I think I told you too that I did actually do one spinal myself before I finished residence, just to say, yes, I did a spinal. So ASRA just came at the perfect time. And then, well, the story was I did my training in Liverpool and anesthesia training for 4 years. Then I went to my second emigration was to Canada, and I worked at the hospital for sick children. And I was intent on a career in pediatric anesthesia. I met a colleague from the US while I was in Toronto, and he said, look, I'm going to start a pediatric anesthesia section at Emory University. Would you like to join me? And so I went and met his chairman. His chairman hired me. And essentially, because of my foreign graduate status, my initial work was at Grady Memorial Hospital, which is the big teaching hospital in downtown Atlanta. And so I had to work there for a year until I could get my medical license from Georgia. And so I spent a year there and got my license. And Grady Memorial Hospital was just an ideal teaching hospital, particularly for regional anesthesia. But, I had to learn myself as I was teaching my residents as well. And ASRA happened to come along just at that time. And I went to every meeting in ASRA until I thought I knew how to do most things in regional anesthesia. And then I passed that information on to my residents. I never did quite graduate to do pediatric anesthesia. My boss kept saying, will you stay at Grady Hospital one more year? And 15 years later, that's what happened. And I loved it. It was a thriving teaching hospital, and it was a great place to, the patients were really needed it and benefited greatly from it. And so did the trainees. And so we started our own little regional anesthesia area in Georgia. And we invited Danny Moore to come and demonstrate some of his work. Prithvi Raj also came. So it was fun. It was an enormous time. Anyway, I'll get back to answering the question. Well, education was a major thing for sure. Yeah. And the other thing, though, that ASRA did was that they did generate some money, and they reinvested that money not just in education but also in research. And so that was my other word. They basically invested in themselves, and that was just tremendous. And that's, I'm very, very proud of what ASRA did in that respect. So the third word I think I might have used in the past was altruism. It was an altruistic society, and we basically were investing in ourselves, and we were attracting more and more people, and we are now one of the most successful subspecialty organizations in all of North America. Yeah. The last word I would use again, and I mentioned it earlier, they're family. We just love being with each other. We love talking about regional, even though we are no longer doing it. There's still a wonderful crowd, and great fun to be around. Very humorous group, and I just love my time. Of all the meetings I went to, ASRA was one of the happiest.
Yeah, I completely agree with you. So yeah, you said actually you were pretty spot on. You had said progressive. You had talked about giving back, and you had talked about research. So very similar. But I love adding family in there too. To me, that is definitely a word that I would use to describe ASRA. And I think a lot of people who are very involved in it would use that word too. So I really like. I'll give you 4 words so that we can add that one in. But it got me thinking a little bit when you were talking about education, because education back then was really the only education you had was maybe a textbook, right? But it was probably Miller or something that was, not super in depth. There weren't many actually atlases, and there certainly wasn't YouTube or anything like that people use nowadays. So you had to go to meetings. That was the workshops were the only way that you could really learn how to do these things, other than visiting somebody, but again, that was hard to do too. So I really think that education piece, we continue to do it, but I feel like it was even more critical back then.
Oh yeah, the book that we all everybody had in those days was Bromwich's book on epidural anesthesia, and that was just that was the only book I think I took with me when I left Ireland to go to North America. That and Goodman and Gilman.
Yeah. So yeah, the textbooks have gotten so much better, and the atlases, and with the images and the drawings, it's just so much better. But still, it just doesn't substitute for being there and hearing people talk about their tips and their tricks and how they do it, and it's just so important.
Yeah, there were a few other characters. I'm sure I've left out many people, but Nicholas Green was one of my favorite people to listen to. When he talked about spinal anesthesia, and his book was just a masterpiece. And McIntosh's book, I still have a copy of that, and he actually autographed it. And
Oh, nice.
And he said, do people still buy this old thing? That's what he said to me when he was signing it. And I said, yeah, we love that little book. I don't know, I'm sure you've seen a copy of it. He did one on lumbar puncture and spinal anesthesia. It was a fantastic book, and only a small little book.
Yeah.
But, it's a classic.
Yeah, definitely. So anything else that you want to talk about? Anything else you want to share with us?
Well, I just go back to that time in UK in the training program, and I remember, I was very enthusiastic, and I wanted to learn some new things, and spinal anesthesia, like I said, there were two generations who never were exposed to spinal anesthesia, and the story is really quite interesting, and you've probably heard it. But the case, it was a big law case. In fact, McIntosh was the expert witness, and where in somewhere in the north of England, two patients in adjoining operating rooms were paralyzed following spinal anesthesia by the same anesthesiologist, and essentially got into the British press, and you just couldn't even mention spinal anesthesia. It meant paralysis. The patients would say it. I don't want to be paralyzed, doctor, and that went on for 50 years. It was just banned. You couldn't do it. And that was something that was called a Woolley and Rowe case. I don't know how Rowe seems to get into every case, but it's Woolley and Rowe case. It was a great story, and what they discovered afterwards, that it was contamination of the sterilizing solution that seeped into the vials. But it's an interesting story, which probably is almost forgotten now, because they do spinal anesthesia in Britain now all the time, and it's perfectly safe. But it's still, even today, patients still have that memory, and they say, "Oh, I don't want to be paralyzed." So
Right.
Anyway, I thought that was one little anecdote I'd share with you.
Yeah. No, that definitely did have a huge impact, didn't it? It takes a long time to recover from something like that.
Oh, for sure. Yeah.
Yeah. So.
Yeah, I remember attempting to do a beer block, and the attending came and he said, "What the hell are you doing?" And I said, "This is a really good block." He said, "Stop this right away. This is dangerous." And that was the sum total of my regional anesthesia training in the University of Liverpool. So you can see why I was motivated to join ASRA.
Yes, definitely. I really thank you for taking your time again to spend with me, to talk about your memories of ASRA and memories of regional anesthesia. It's really important. I can't believe that we're already, coming up on this sort of an anniversary here within ASRA. It's pretty fantastic how long this organization has existed in one form or another. And you're a huge part of that. And so I want to thank you for all of your time and your service to ASRA and all of the things that you've done to make it the society that it is today. You should be very proud.
Well, thank you very much. I really enjoyed talking to you.